Welcome to our presentation on gout. This presentation was created by myself, Dana McCormick, along with Tiana Rogers. Today we'll be examining the concept of mobility, the exemplar of gout, and the medication used for gout called colchicine.
Mobility refers to purposeful physical movement, including gross simple movements, fine complex movements, and coordination. This definition was found within Giddens' textbook, page 252, year 2017. The key attributes of the concept of mobility are musculoskeletal, neurologic, and neuromuscular processes. Today, this presentation will focus on the musculoskeletal attribute as it relates to gout. However, neurologic and neuromuscular conditions include the brain, spinal cord, and peripheral nerves affecting mobility. Optimal mobility requires bones, joints, articular cartilage, tendons and ligaments, skeletal muscle, and mechanics of muscle contraction. Any alterations in these aspects will result in partial mobility or complete immobility. For all movements, an intact neurological system is required.
Mobility is an interrelated concept that can affect the processes of other functions in the body if altered, such as intracranial regulation, nutrition, pain, gas exchange, and perfusion. Immobility can also put tissue integrity and elimination at risk.
Gout is a type of arthritis and can be referred to as gouty arthritis. There are three main causes of gout, including increased uric acid production, decreased uric acid excretion by the kidneys, and an increased consumption of purine-rich foods. This buildup of uric acid in the body will cause uric acid crystals that accumulate in joints, such as articular and periarticular joints, and they're also found in subcutaneous tissue. This diagram shows some examples of how these causes could occur and lead to uric crystals within the body.
There are two classifications of gout called primary and secondary gout. Primary gout is solely related to a hereditary condition resulting in increased uric acid, whereas secondary gout involves other acquired disorders that can produce an increase in uric acid in the body, or drugs that can increase the rate of cell death.
There are several manifestations and complications that can occur with gouty arthritis. Two phases of gouty arthritis that we will be discussing will be the acute phase of gouty arthritis and the chronic phase of gouty arthritis. In the acute phase, gout can be triggered by events such as trauma or surgery and usually only affect 1 to 4 joints in the body. The joints that are affected are most likely to become cyanotic and tender. However, the most common initial sign of an acute gouty attack is podagra, which is inflammation of the big toe. Symptoms of gout include swelling of the joints, excruciating pain, and a low-grade fever. These symptoms will begin at nighttime, usually, and they will eventually subside between 2 to 10 days, returning back to completely normal until another attack. Chronic gout, on the other hand, involves multiple joints with visible deposits called tophi. Chronic inflammation may be present and result in joint and cartilage destruction and deformity. There is also potential for skin perforation from large tophaceous deposits and can cause infection. Kidney or urinary tract stones could possibly form due to excess uric acid excretion or even pyelonephritis from intrarenal sodium urate deposits, causing an obstruction. The severity of gout is variable and can cause infrequent mild attacks or severe episodes. Basically, the higher the serum acid levels in the body, the earlier that symptoms and side effects will appear.
During patient history, questions can be asked related to hypertension, diuretic use, and excessive alcohol, obesity, and diet rich in purines, as they are risk factors for gout. A physical assessment can be done to find tophi in joints and to assess the range of motion. A pain scale can also be completed during the assessment phase.
A serum uric acid level test can be taken to see if levels are elevated to 0.51 millimoles a liter, as normal levels range between 0.14 to 0.41 millimoles a liter. This could be a sign of gout. However, hyperuricemia doesn't directly diagnose gout because the increase may be related to other factors that affect the serum uric acid levels. Another test that can be performed is a 24-hour urine uric acid test. This can prove if the patient has decreased renal excretion or overproduction of uric acid. An aspiration of the synovial fluid can be completed to determine gout, as there would be needle-like crystals. This can also be therapeutic, as it would decompress the swollen joint capsule. Lastly, an X-ray can be completed. During the acute gout phase, there would be no changes seen. However, during the chronic gout phase, there would be tophi shown as eroded areas in the bone.
This diagram represents all of the main health and illness concepts relating to gout, along with the manifestations and complications listed under each concept. An example would be Infection, in dark green, is a large health and illness concept covered in NURS2514 and NURS2500. With gout, a common manifestation would be a low-grade fever, shown in dark blue, and complications that could possibly occur with gout would be pyelonephritis, inflammation of the kidney, and infection of the skin from perforation due to the tophi, shown in light blue.
The indication of the drug colchicine is used commonly for acute gouty arthritis. It will reduce inflammation in the joint by inhibiting the synthesis of microtubules, which are structures that help white blood cells infiltrate an area. This medication does not have any analgesic properties and therefore is mostly used with NSAIDs. Although by reducing the inflammation with this drug, it will overall reduce the pain that is being experienced. Colchicine has an unknown onset of action. It peaks between half an hour to 2 hours, and the half-life of this drug is 20 minutes if taken orally. By taking this drug orally, it will reduce the incidence of attacks between 1 to 2 days. Colchicine is well absorbed, distributed within the white blood cells, and it's metabolized by the liver and also excreted in the feces. The desired therapeutic effect of this drug is to decrease the inflammation in the joint, which then leads to a decrease in the pain. These therapeutic effects will hopefully restore mobility in the patient. It is also important for the patient to consider lifestyle and diet modifications to prevent uric acid buildup in the body. Some lifestyle modifications can include weight loss, decrease in purine diet, decrease in alcohol consumption, and limiting sodium in the diet to reduce hypertension.
Side effects of colchicine is GI upset, nausea, and vomiting. It can interfere with the absorption of vitamin B12 and can interact with many drugs, for example, loop diuretics. This drug may be contraindicated in patients with decreased hepatic function as well as renal insufficiency and should not be taken with grapefruit. To assess for these side effects, we would ask the patient interview questions to know if they are nauseous or have vomited. We could then perform a GI assessment using auscultation and palpation. An OPQ-RSTU interview can be used to identify the level of pain the patient is experiencing and if the pain is decreasing with the drug. If the patient presented with a low-grade fever, we can assess the temperature to evaluate if the temperature is decreasing.
This concludes our presentation on gout. Today we discussed the concept of mobility, the pathophysiology of the exemplar gout, along with the manifestations. We evaluated key nursing assessments and diagnostics for a patient experiencing gout and discussed colchicine as the drug for acute gouty arthritis. Thank you for watching our presentation today. We hope you enjoyed it.